How to pass FCPS Part 1 in Medicine and Allied. Rule number 1. Instead of taking out your old heavy medical school books and building concepts, only try to recall and memorize the high yield facts. And the best way to do that is going for short books instead. And for better time management, rely on the least number of books possible. The book that I used to pass part 1 in first attempt was FCPS Pearls. But remember that it is more of a quick recall than a proper book, thus you can't understand it without a short reference book. For me it was BRS Physiology. Okay, so FCPS Pearls is a book that has two portions, a theory portion and an MCQs portion. The MCQs portion is very lengthy. The theory portion has further different subjects like anatomy, physio, biochem, etc. The importance of each of these subjects relies on the specialty you are opting for. So, if you are choosing medicine and allied, your main focus should be physio. If you are going for surgery, then anatomy, and for gynae, you should uh, make your main focus embryo. Now, you once you have chosen your main subject of interest, for me it was physio since I was opting for medicine. You can easily cover the rest from ChatGPT and Google Diagrams along with FCPS Pulse. Now, when you have covered some of the theory, you can start with MCQs. Do keep in mind that the MCQ bank is based on recalls only and has many mistakes and incomplete stems. The second thing is that though it has thousands of MCQs, but there is a lot of repetitions. So in the beginning, you'll be finding yourself very slow, but you'll catch on as you progress. My advice to you is not to spend a lot of time wasting your time on Facebook groups and WhatsApp groups and discussing the correct answer rather than choosing a single study partner. Repetition is the key. Now, you should revise FCPS Pulse at least twice. In the second go, only revise the highlighted ones and forget about the MCQs that have been constantly repeated. Now, what should you expect on the exam day? As you know that part 1 exam isn't taken on a paper and a pen. You will solve these MCQs on a laptop already arranged on your allotted chair in the exam hall. Part 1 has two papers, paper A and paper B. Each has 100 MCQs and each paper has to be completed in 2 hours. So you'll have plenty of time and you'll also have a tea break in between these two papers. When you sit on your chair, the screen will already show your picture and you will log in. Each MCQ will appear on the screen separately and there will be a timer at the top right corner and a skip button on the screen as well. My advice is not to rush as you will have plenty of time to solve the MCQs. So in the first go, leave all the ones that you are even slightly doubtful of. At the end, I would suggest three things. Number one, not to rush. Number two, not to underestimate details, because even details like nerve root values are important. The other thing that I would suggest is having a very strict schedule. Efficient time management is very important, and especially for the main subject of interest. The best way to do that is your own schedule and sticking to it. And the most important is having a good sleep on the night before exam. So if you're insomniac, you right before exam, on the night around 8 and 9 p.m. you can use zolpidem 10 milligram. um, Best of luck and do stick to a strict schedule.